Integrated Health Center of the Rockies Clinic is changing the lives of thousands of type 2 diabetics, showing them how to reduce and eliminate the need for prescription medications and insulin. You can attend a free diabetic dinner event to learn more. Joining us now, of course, is Communications Director for the Integrated Health Center of the Rockies, Miss Amanda Vargas. We're so glad to have you here.
Thanks for having me.
Now, when it comes to type 2 diabetics, so many of them work so hard. They change their diet, they work out, they really try to do everything they can to keep their disease under control, yet it is still so frustrating. Why does it cause so much frustration and destruction?
Well, we find that diabetics are frustrated because they're not treated as individuals, but rather as a label, meaning they're treated like a diabetic. And generally speaking, one diabetic is treated the exact same as every other diabetic. So they're put on drug after drug, injection after injection, and then they're given very general health advice like lose weight, exercise more, and change your diet. But what we find is that instead of getting better with time, these patients actually get worse. And while they're trying to get their numbers lower, like their A1C and their blood sugars, their risk of complications increases. So they might be at a high risk still of amputation, blindness, loss of one of their limbs, or loss of their life. So not only are diabetics frustrated, but they're equally living in fear of what seems to be the inevitable.
Yeah, the inevitable. So tell me about what your health providers are doing differently.
Well, they start by treating each patient like that individual and not the diabetic label. They work very thoroughly on the front end to figure out what the root cause is of their problem. And when we say root cause, we're not referring to things like weight loss, genetics, or diet, or anything like that, because there's so much more to the causes of diabetes than just those things. And interestingly enough, the majority of the patients who come to see us all have different causes for why they have this disease. So they have to be treated differently, and that's exactly what we do with customized care plans.
That's so interesting. So tell us the type of results you're seeing at IHCR.
Well, the results are amazing. We're seeing patients reduce and eliminate their need for prescription drugs and insulin. They're losing weight without exercise. They're getting off of so many of their meds, and then they're able to lose the weight that comes with taking all of those medications, and they're able to achieve normalcy in their lives again. It's really amazing what we're able to see.
The quality of life, yes, obviously going through the roof. We love that. Okay, so there's a free diabetic dinner event that's going on. It's February 11th at 6 p.m. And all you have to do is call the number you see right here on your screen to RSVP, because seating is limited. You want to make sure you get a seat if you are in fact interested to do this. All right, so now you were talking about some of basically the reversal of the disease, were you not?
Yeah, that's right. And that's the exciting part. There's so many diabetics who will spend an entire lifetime just trying to manage this disease, and that fight will fail them in a very big way. But in our office, instead of just managing this disease, they actually have the opportunity to reverse it and go from pre-diabetic to non-diabetic, or even full-blown diabetic to non-diabetic. And it's truly amazing what we see.
You can't come here and talk about these wonderful results without giving us an example. I love hearing your stories of success.
Okay, let's talk about Bruce. He's one of my absolute favorites. In just 2 months, he went from diabetic to non-diabetic. He lost almost 20 pounds, dropped multiple pant sizes, almost got off of his blood pressure medication. He got off of his statin, and listen to this, he got off of every single one of his diabetic medications in 2 months.
2 months.
2 months.
That is less than 10 weeks.
Yeah.
Amazing. Okay, I'm going to tell you this information again because you want to see those kind of results too. Right there on your screen, you see this February 11th at 6 p.m. There's a free diabetic dinner event. All you have to do is call the number you see right there to reserve your seat, because again, seating is very limited. Go ahead and call that number. All right, let's talk about how quickly, I don't know if everyone can be like Bruce in 2 months, but how quickly do most people start seeing the results?
Of course, like you just said, everyone is different, but it's very rare for us to see a patient who doesn't start to succeed in just a matter of a few weeks. And remember, this isn't your standard run-of-the-mill diabetic care plan, but rather a treatment program that's catered towards these individuals so that they can achieve optimal results and reverse their type 2 diabetes.
When you come, you always talk about quality of life, obviously working to make that better for everyone. Yes. Again, Amanda, thank you so much. Let's remind everyone, all you have to do is call the number you see right there on your screen, 303-974-1087, to learn how you can reserve a seat for Integrated Health's free diabetic dinner and seminar event on Tuesday, February 11th at 6 p.m. Once again, that phone number, 303-974-1087. Integrated Health Center of the Rockies paid for this segment. Stay with us.